6. Group dynamics. Group dynamics play a significant role in healthcare decision-making. Effective decision-making often involves collaboration between multiple stakeholders, such as healthcare professionals, patients, and other staff members. However, group dynamics can also have negative impacts on the decision-making process. Groupthink is a phenomenon where group members prioritize conformity over critical thinking and may suppress dissenting opinions or alternative viewpoints. This can lead to poor decision-making, as important information or perspectives may be overlooked or dismissed. To avoid group thinking, healthcare managers should encourage open and honest communication and be willing to consider alternative viewpoints and dissenting opinions. Other group dynamics can also impact decision-making in healthcare. For example, power dynamics within the group can influence how decisions are made, with more powerful stakeholders having more influence over the decision-making process. To mitigate the impact of power dynamics, healthcare managers should work to create a culture of collaboration and inclusivity, where all stakeholders are given an equal voice in the decision-making process. Effective communication is also essential in managing group dynamics in healthcare decision-making. Managers may need to facilitate discussions and ensure that all stakeholders are given the opportunity to share their perspectives and opinions. This may involve using decision-making frameworks or other tools to guide the discussion, and ensure that all relevant factors are considered. Overall, group dynamics can significantly impact decision-making in healthcare. By being aware of the potential impact of group dynamics and working to promote open and honest communication, collaboration, and inclusivity, healthcare managers can support effective and informed decision-making that reflects the perspectives and experiences of all stakeholders. To examine the decision-making process, healthcare managers may use various methods, such as surveys, interviews, or focus groups, to collect feedback from stakeholders on their experience of the decision-making process. They may also review documentation, such as meeting minutes or decision memos, to gain insight into the factors and criteria considered during the decision-making process. Healthcare managers should consider whether the decision-making process was transparent and whether all stakeholders had the opportunity to provide input and feedback. They should also assess whether the decision-making process was inclusive and whether all perspectives and concerns were taken into account. In addition, healthcare managers should evaluate whether the decision-making process was based on accurate and relevant information. This may involve assessing the quality and completeness of data used to inform the decision-making process, as well as evaluating the methods and tools used to evaluate different alternatives. By examining the decision-making process, healthcare managers can identify areas for improvement and implement new tools or strategies to support more effective decision-making in the future. Characteristics and estimation of risk and returns in healthcare. The purpose of this section is to explore the characteristics and estimation of risk and returns in healthcare management. Healthcare organizations must strike a balance between providing high-quality care and managing financial risk to ensure their long-term success. Understanding the nature of risk and return in the sector is crucial for effective decision-making and resource allocation. Characteristics of risk in healthcare. Clinical risks. Clinical risks encompass a range of potential hazards and adverse events that may arise during the provision of healthcare services. They can result from various factors, such as misdiagnosis, medication errors, inadequate infection control, surgical complications, and poor communication amongst healthcare professionals. Patient safety is a significant concern in clinical risk management as it seeks to minimize the potential for harm or injury during medical treatment. Inadequate patient safety measures can lead to increased morbidity, mortality, and a decrease in overall quality of care. Furthermore, medical errors, which are estimated to be the third leading cause of death in the United States, can result from a variety of factors, including human factors, system failures, and inadequate technology. Medical errors and adverse events can also have significant financial implications, as they can lead to malpractice lawsuits and compensation payouts. In addition to the direct costs, healthcare organizations may also face reputational damage, which can result in a loss of trust among patients, reduced patient volume, and difficulty attracting and retaining healthcare professionals. Efforts to mitigate clinical risks often involve implementing evidence-based practices, promoting a culture of safety, and using quality improvement initiatives to continuously monitor and enhance healthcare processes. By addressing clinical risks, healthcare organizations can work towards providing safer and higher quality care to patients, ultimately improving patient outcomes and reducing the burden on the healthcare system. Financial risks. Financial risks in healthcare encompass various factors that can lead to fluctuations in revenue and expenses, ultimately affecting the financial stability of healthcare organizations. These risks can arise from changes in patient volume, reimbursement rates, and operating costs, as well as from external factors such as economic conditions, regulatory changes, and technological advancements. Changes in patient volume can significantly impact a healthcare organization's financial stability, as patient numbers directly correlate with revenue. Factors that can influence patient volume include demographic shifts, the prevalence of specific diseases, competition from other healthcare providers, and public perception of the organization's quality of care. A decrease in patient volume can result in reduced revenue and may necessitate cost-cutting measures or the adjustment of service offerings. Reimbursement rates are another critical financial risk faced by healthcare organizations. These rates are determined by various payers, such as government programs, private insurance companies, and patients themselves. Changes in reimbursement policies, payment models, or the mix of patients' insurance coverage can affect the revenue generated by healthcare services. Organizations need to constantly monitor and adapt to changes in reimbursement rates and policies to maintain financial stability. Operating costs are essential to consider when assessing financial risks. These costs include personnel expenses such as salaries and benefits, facility and equipment costs, including maintenance and upgrades, and the costs of supplies, medications, and other resources necessary for providing care. Inflation, increased labor costs, and the rising price of medical supplies and pharmaceuticals can all contribute to higher operating costs. Healthcare organizations must actively manage their expenses, optimize resource utilization, and seek opportunities for cost-saving efficiencies. External factors such as changes in economic conditions or regulations can also impact the financial stability of healthcare organizations. Economic downturns can lead to reduced patient volume and lower reimbursement rates, while new regulations or compliance requirements can result in increased operation costs. Staying informed of regulatory changes and adapting organizational practices accordingly is crucial to managing financial risks. Effective financial risk management is crucial for healthcare organizations to ensure their financial stability and the continued provision of care by closely monitoring revenue streams, expenses, and external factors and adapting to changes as needed. Healthcare organizations can mitigate financial risks and maintain their capacity to deliver high-quality care to patients.